One of the things that we need to be very clear about is what is appropriate PPE for each situation. And we have been doing quite a lot of work on that around in the hospital, and what do you wear in different sessions, what do you need when you're caring for somebody with COVID-19, what do you need when you're caring for others in that setting right now, in long-term care and all of our health care settings. And we are having discussions, ongoing discussions with our community healthcare professions, including physiotherapy and OT and physicians and dentists in the community. So those guidance are coming around what is appropriate PPE in those situations. When we're talking about businesses, we're not talking about the same level of, the same type of personal protective equipment, because what is needed in the healthcare sector, so medical masks and medical respirators, things like that, are different than what we need in the community when we can, for the most part, maintain our physical distances. So we're basing our responses on the layers that we need to protect people. So we can either have we can decrease our numbers of contacts, or we can increase our safe contacts. And what we need to look at in the businesses that are opening and in our social connections is, how do we have safe contacts? And that may mean keeping our distance. It may mean the use of barriers in different areas, reducing the number of people in a store, for example, having those models where you have a hybrid of online versus in-store shopping, and in some cases where you can't consistently maintain that distance, the wearing of non-medical masks in the community. So those are all details that will become clearer as we work our way together through this next few weeks.
I've been updating, I think, every Tuesday on the number of on PPE that's come into the province in that previous week, and I'll be doing that tomorrow. But as noted, we've obtained 3.5 million, for example, N95 masks or respirators in the province since the beginning of April, and we haven't deployed those yet because we're going through a very systematic effort to ensure that they meet our standards, and as well that we work with healthcare workers to make sure that the fit is right, and that we work with them on a product that, for example, one that doesn't say 3M on it because it's not from 3M, who's our main and traditional supplier. We've also maintained supplies from some of our traditional suppliers as well in smaller numbers. Obviously, the international market has been profoundly disrupted, but we've been successful, I think, in obtaining very significant quantities of PPE, which I'll be again reporting on tomorrow. I would say this, though, that work is going to continue in the days and the weeks and the months ahead, because COVID-19 is, there is no vaccine, as we've said many times, there is no cure. And we have to prepare not just for now, not just for the immediate, not just for the relaunching of surgeries, which you're quite right, requires sufficient supplies of PPE, but in the weeks and months and so on to come, which means, I think, in Canada, ensuring that we have better domestic supply of PPE, given the disruption to the international market that has taken place and will continue to take place. And we have to continue to do the work so we not only have supplies now, but supplies in September and October and November, and have developed a very large stockpile to meet even an increase in the utilization, the likes of which we've seen in recent months. So that's the situation right now, and I'll have more for you tomorrow.